Hi, I'm Dr. Arusa, and today's topic is about hemorrhoids. Hemorrhoids are basically anal cushions which when become symptomatic we name them as hemorrhoids. What is meant by anal cushions and what are they? Anal cushions are normally normal structures in anal canal, that is vascular and connective tissue cushions that are present in anal canal above the dentate line. They are present in three locations. If we consider this as the anal canal and patient is in the lithotomy position, this is right side and this is left side of patient. Then normally anal cushions are present at 3, 7 and 11 o'clock position. This is 11 o'clock and 7 o'clock and 3 o'clock. This is according to the position of patient if we consider is at anterior and posterior side. Close to the urethra, this is close to the urethra and this is to the natal cleft. This division of the anal canal, anal cushions in the anal canal is due to the anatomical division of vessels in anal canal. If we consider rectum, obstructions of the rectum, and at the end there is narrowing of rectum to make the anal canal, and then finally the anus. Consider it as the dentate line that anatomically separates rectum from anus. This is demarcation anatomically, but there is another demarcation surgical point of view that separates the rectum from anus. I will tell you later. But first of all, listen to the point that why it is at 3, 7 and 11 o'clock position. Superior rectal vessels that are the branches of inferior from inferior mesenteric vessel, and superior rectal artery divided into anterior and posterior branch on right side and on left branch on left side. So that is why at left side it is they form left lateral anal cushion, and on right side it form right anterior and right posterior anal cushions. So that form it at that make them at 3, 7 and 11 o'clock position. So next, to form the hemorrhoidal plexus, middle rectal vessel came from hypogastric vessels, and inferior rectal or hemorrhoidal vessels come from pudendal vessels. This is the main theme of portosystemic anastomosis here, when the superior rectal veins that are coming from inferior mesenteric vessel, the part of portal system, and the pudendal vessel that are the part of systemic vascular system. When they combine at this point, they form the varices which we call them as rectal varices in the case of patient with portal hypertension. So apart from this, we are at the topic of hemorrhoids. Inferior hemorrhoidal vessels that are form plexus near the anus, they form the external hemorrhoids. Internal hemorrhoids, according to this picture, they are at anterior position, at posterior position, and at left lateral position. These are true hemorrhoids because they are the dilation, or you can say that distension of anal cushions. This is the area of external hemorrhoids. External hemorrhoids are not true hemorrhoids, and there is no specific location of external hemorrhoids. External hemorrhoids are basically secondary to the internal hemorrhoid, when the pressure on internal hemorrhoid is so much that it causes venous congestion of this plexus, and at the end inferior hemorrhoidal vessel become congested and they bulge out of the anus to form the external hemorrhoids. It is possible that external hemorrhoids alone are present due to any other rectal pathology or anal pathology in case of C rectum, or in case of any venous congestion, or any anomaly which increase pressure on inferior hemorrhoidal plexus. But this is, but my point is that this is not true hemorrhoids, as basically hemorrhoids are symptomatic anal cushions. So if anyone asks you about that, what are true hemorrhoids, then you have to must say that it is internal hemorrhoids that are present at 3, 7 and 11 o'clock position, and external hemorrhoids are not true hemorrhoids, they are false hemorrhoids, and both of them are present at the same time most of the time. But they are present, they are present lonely as well. So you have to keep in mind, this is the basic theme that we miss many of the time, that internal hemorrhoids are separate, internal hemorrhoids are external hemorrhoids, both are of same entity, but these are not same. The internal hemorrhoids are dilated anal cushions, and external hemorrhoids are the dilation of just inferior hemorrhoidal plexus. And second thing to remember is that previously I said that I will tell you about what is surgical and anatomical division of anal canal. If we consider again, it is at rectum, and this is narrowing of rectum anal canal, and this is anus, this is dentate line. Dentate line separates the rectum from anus anatomically, and if we want to classify or divide anus from rectum surgically or clinically, then it is on the basis of ring feel internally when we do the digital rectal examination, and this is because of the muscles present at this point at the rectoanal junction. What are these muscles? These muscles are basically puborectalis and deep part of external sphincter muscle. This is external sphincter, and it has three parts: deep, superficial, and this is subcutaneous part, which is just near the anus. This is internal sphincter. These muscles and conjoined tendon make the surgical divide surgically rectum from anus, puborectalis, deep part of external sphincter muscle, and conjoined muscles which is present here. These divide the rectum from anus. This is important because clinically we just feel the ring which just separates the rectum from anus. Puborectalis muscle, how the ring is basically maintained. Puborectalis muscle, which is present, if we see the coronal section, this is in a female patient, this is uterus, and this is rectum with an anus angulated anteriorly, and this vagina. This angulation is formed by the puborectalis muscle, which form a sling around the anus, and this is the main reason behind the ring formation in the at the level of rectoanal junction. This is rectum, and the one important thing that I just missed in the start, that what are the main important function of anal cushions. Anal nature had this beautiful advantages that anal cushions basically form the airtight seal in the anal canal, due to which we have control on our flatus. That if we have voluntary control on passing flatus, it provides airtight control. And one more thing I just want to mention, the internal sphincter muscle is involuntary muscle, and through involuntary muscle and external sphincter muscle is our voluntary muscle that is supplied by the somatic nerves, And through external sphincter muscles we have control on we have some voluntary control on our continence, and internal sphincter is according to the action of gastrorectal or colorectal reflex act on the basis of these reflexes. But external sphincter is just our and control, and we can say that through which we can have control on our faces, and with the help of anal cushion we have control on our on. So till then, in a nutshell, we have learned that hemorrhoids are, if we say technically what are hemorrhoids, they are dilated anal cushions, and anal cushions have specific role in our body, that they have flatus control. And the best thing that I have learned while reading in book, that external hemorrhoids are not true hemorrhoids, are not true hemorrhoids. This is a big no to true hemorrhoids. These are basically dilation of inferior hypogastric plexus. Thank you.